Hello, my name is Maitane Duarte, and I'm the CSO of Nanokide Therapeutics. Nanokide is a startup from the University of Basque Country, and it was born to produce new and more efficient treatments against cancer. In 2020, around 18.3 million people were diagnosed with some kind of cancer, and it is expected that for 2040, this number will increase up to 28.9 million. Specifically, in the case of colorectal cancer, that it's the third more diagnosed type of cancer worldwide, the incidence was 1.8 million people, and half of them died during the year. So we can say that despite their early diagnosis programs, the current treatments are still not good enough for a big part of the population. The main reason might be because these traditional treatments are focused on attacking and killing only the tumor cells, and they have a limited efficacy and severe side effects, as you might know. In Nanokide, we develop a new treatment based in a nanoparticle that targets directly the tumor cells, but also some of the cells around that are affected by the tumoral process. Our nanoparticle is more efficient and it's not toxic comparing with the traditional treatments. With our nanoparticle, we stop the angiogenic process. What is this? So when the tumor, they don't have enough oxygen or glucose for growing, they start sending signals to the blood vessels around, and the endothelial cells of these blood vessels start to change their phenotype and reproduce, and they grow new blood vessels to nourish the tumor. In our lab, we identify a downregulation of MIR20, one type of microRNA, in the tumoral cells, but also in these endothelial cells that are transformed by the tumoral process. And we can direct our nanoparticle specifically to these kind of cells and transfect the MIR20. And due to this process, the cells, instead of killing them, we are reverting the phenotype to the physiological state. Like this, we get that some of these tumor cells, they disappear. We avoid the formation of new blood vessels, and the tumor have not source of oxygen. So the test we did with animals, they showed 80% of reduction of the tumor size, and this treatment in vitro has been 30% more efficient than the gold standard in the anti-angiogenic therapies that is Avastin right now. Here you can see for new treatments that are already in the market, anti-angiogenic treatments. Our nanoparticle, as the other treatments based in antibodies, is specific and has low toxicity, and in addition, is cheaper and easier to produce. It is multi-target, as I already explained, and we can directly, specifically to the affected cells. The expected market in colorectal cancer in 2025 is $11 billion, and 4.3 of those will be focused on creating anti-angiogenic therapies, as the product I already explained. So our nanoparticle core is a Spain-based nanosystem that has two advantages. In one side, it is classified as GRAS by the FDA, generally recognized as safe, so it's non-toxic. And it allows us to decorate this nanoparticle to add different compounds to lead the nanoparticle to a specific kind of cells. In addition, it has a positive charge, and this allows us to load genetic material as microRNA or mRNA. And I want to mention that this system is protected by a patent in Europe and USA. Due to the flexibility of this system, we are currently developing more prototypes. I already told you about the anti-angiogenic prototype that it's in the preclinical phase, but we have another 2 prototypes in the discovery phase. The second one is an anti-cancer stem cell therapy. The cancer stem cells are usually the responsible ones of recurrency and resistance to chemotherapy. And the third prototype is an immunotherapy that we are currently designing the therapy. And we are developing neural networks to know which neoantigens will develop its patient in their kind of cancer. Here I show you the core team of Nanokide, Iker Badiola, the founder, Isabel Rial and myself, and we have a panel of external advisors too, Andrea Pensado from Okinawa Institute in Japan, Marco Arauzo Bravo from Biodonostia, and Majid Katif from INSERV of Bordeaux. Nanokide was founded in March of 2021. Later that year, we designed the business plan, and recently we signed the patent transfer with the University of the Basque Country. In March of 2022, we received a technical report from Innocua company that show us the experiments we need to do with the prototype Y to arrive to the clinical phase. And they estimate that we will need 11 months and around 600,000 euros. In addition, we need to continue developing the prototype 1 and 2. I only want to mention 2 recent achievements. We were accepted by a very competitive program of the NIH grant, and we were granted with the with the Cantabric Excellence Award in Research, Development and Innovation category. So finally, this is our partners. We need to especially thank you to Beas Vizcaya and the University of Basque Country because they have been crucial for the creation of Nanokide. And here you have my contact information and the QR code for LinkedIn if you want to follow us. Thank you a lot.